Of people in our area are at risk of disruptions in their health insurance or having to switch providers. This is all because of ongoing negotiations between TriHealth and United Healthcare. Now, with both companies not backing down, people in need of critical procedures or birthing plans are stuck in limbo.
So as of now, December 31st will be the last day that United Healthcare is in network with TriHealth providers and facilities.
Unless negotiations change quickly between one of the country's largest healthcare companies and one of our area's primary hospital groups, some 80,000 patients will have to pivot in a major way.
A lot of patients, if they are in the middle of an episode of care, whether that's treatment for their heart or for cancer or maybe pregnancy, you know, these things don't end magically on December 31st.
The two companies have been in talks on the new deal for a year now. TriHealth says they came to the table seeking three things: fair reimbursement from UHC, less administrative red tape, and more appreciation for their quality of care at a lower cost than other area providers.
So what United would give our other health systems in the region is less than what we're getting. So that's a big thing, and we have collaborative agreements with other payers and that's really what we're looking for, is just to get up to par.
I reached out to United Healthcare for an interview, but they sent us a statement about the negotiations. It says, in part, TriHealth is demanding a 35% hike that would make it more expensive than any peer health system in the Cincinnati market. Approximately $80 million of the $94 million TriHealth is seeking would come out of the operating budgets of local employers, impacting the money they have to grow their business and compensate their employees. We are proposing rate increases that continue to reimburse TriHealth at market competitive rates. Well, the two companies are hoping to work out a continuity of care deal. This means that if negotiations go past the end of this year, patients who are in critical need can stay with their provider. TriHealth says that still would be up to the mercy and good faith of United Healthcare. We'll continue to update this story as it develops.